Did you know that you do not have to be hooked up to the fetal monitor during your labor? Hi, I'm Dr. Toya, board certified OBGYN, and I wanted to talk about intermittent monitoring or intermittent auscultation during labor. So I'm a fan of this. I had this done with my first delivery, and it is something that's safe and actually supported by ACOG. So, the typical way hospital births go is that you get admitted for labor, they hook you up on the monitors, and you just stay on the monitors until you have the baby. So there is another option, and it really depends on the hospital, that you can just have the baby listened to over certain intervals depending on where you are in your labor process. And the reason that we do continuous monitoring is to theoretically reduce the risk of complications for the baby. But as we can see here in the ACOG document, it has not been shown to prevent negative outcomes like perinatal death and cerebral palsy in patients with low-risk pregnancy. So obviously not somebody who is having a high-risk issue that they're there for, but it's definitely an option for the majority of patients. And this can be done if you're being induced as well, but again, it depends on the hospital policy. I was induced with my first, and they gave me my Cytotec, and after a certain amount of time on the monitor, I was able to get up and walk around. And I think it's important to consider because we also know that being on continuous monitoring can increase the rate of C-sections. And the reason is because we see changes in the heart rate that may not necessarily translate to negative outcomes in the baby, but we act on it because we can see it. So you end up doing more C-sections than may be necessary because we see these changes on the heart rate that really mean nothing. And I think the biggest benefit of intermittent monitoring, even if you're planning to have medication and epidural during birth, you may not necessarily be ready, and you may want to get up and walk around and move to different positions before you're ready for your medication. So it's really nice to not be hooked up to all the monitors during that time. So from a practical standpoint, it can be difficult, which I think is why it's not widespread, because it is technically easier for the hospital staff to have patients on continuous monitoring. If you have intermittent monitoring, you really need a 1-to-1 ratio so that the nurse can be in there listening to the baby. Definitely something to discuss with your doctor if this is an option in the hospital in which you're going to deliver, because most patients will qualify for it once there are no complications during the pregnancy or during labor and delivery. So let me know if you have any questions about intermittent monitoring, and of course, like and follow for more.